Dr. Trust. Trust what's best for your health.
Did you know the human heart beats more than 100,000 times a day? At that pace, it's no wonder you might feel your heart skip a beat or flutter from time to time. In a normal heart, the 4 chambers of the heart beat in a steady rhythmic pattern. However, if you notice your heart suddenly races, or if you have uneven heartbeats that last several minutes, you may have a condition known as atrial fibrillation or AFib. With AFib, the atrium fibrillates and creates an irregular rhythm. AFib is the most common abnormal heart rhythm. The heart works less effectively as a pump, resulting in an area of the heart where the blood flow is slow or stagnant. When this happens, a blood clot can form. AFib can also lead to other medical problems, including heart failure, chronic fatigue, and inconsistent blood supply. The problem with the blood clot in the heart is that some or all of it can break away and travel along our arterial highway directly into the brain. At some stage, the clot or fragment of the clot is going to be too large to progress any further and will block the vessel in which it's traveling, causing the nerve cell to stop working. This complication is called stroke. If you feel shortness of breath, dizzy, weakness, fatigue, or chest pain, you must use the Dr. Trust AFib Pro Blood Pressure Monitor for AFib detection and stroke prevention.
Dr. Trust. Trust what's best for your health.